Hi, this is Dr. Johnson. I hope you are doing well. Today we will be talking about ethics, whether you're working with families or working in a group setting. So, some things to think about is when you're initially establishing this dynamic, whether it's selecting group members, and this could even be said with the family. Part of initiating family therapy is deciding who shall be appropriate to attend those family sessions. And the same can be said for group, ensuring it's a good, healthy working dynamic. This all goes into the ethics, and part of it is the understanding of confidentiality. So sometimes there's that old saying, what you say in group stays in group. So this is one of the biggest areas that you have to think about sometimes is what does that look like? So really hashing out the guidelines and structures and rules ahead of time of confidentiality and what is happening in group stays in group. Because sometimes if you don't take this time and set up the procedures and policies, you might have a few having side conversations outside a group. So just consider that you want to set up a nice firm boundaries that it needs to group therapy is could be beneficial, but also there's some downsides, particularly when you consider confidentiality. Another item to kind of consider is involuntary members of group therapy. A lot of times these groups are open, which means they come and go based on how many sessions they have to do. So this also adds in a future areas that confidentiality or other ethical elements can come into play. So it's reestablishing those group rules, but also looking at checking in with them. What's working? What could be done a little better? And another element is if you have a co-facilitator, so making sure you're on the same page and have a very positive, respectful working relationship. So there's many elements that could cause some ethical issues or ethical dilemmas even. But if you set up the process and procedures, so it's a very smooth working relationship with the group work or while working with families. It sets up the structure very nicely. So there's a lot of benefits to group therapy, especially when working with interactions or seeing problems that or challenges that might arise that are similar that they can really learn from each other. So thank you for listening, and I hope you have a great week.